So hi, everyone. We're going to get started. Thank you all for logging in even earlier. So thank you all so much. I am Danielle Pagani. I am the infectious disease preparedness generalist for the Village of Ridgewood Health Department, and I'm joined by my colleague.
Hi, everyone. My name is Surbi Kapadia. I am the local health outreach coordinator with the Ridgewood Health Department.
We are very excited to have Norkelis Pimentel from the Greater Bergen Community Action Inc. to present on the current rise of respiratory illness. Right now, personally, maybe you know someone who is sick or was sick, or maybe you are sick. I mean, there's a lot going on with COVID, flu, RSV, and of course other seasonal viruses. So we wanted to definitely have a fun educational workshop. So we're excited to have Norkelis with us tonight. Before we get started, I do want to share a brief bio of Norkelis, as well as just go over some of the Zoom logistics. So firstly, Norkelis Pimentel has a master's degree in public health with a concentration in administration and policy. She has been working with Greater Bergen Community Action for a little over a year as the Health Equity Program Manager, serving all of Bergen County. In her time at Greater Bergen, she's been able to accomplish many things, such as providing reliable public health information to over 40,000 New Jersey residents, providing COVID-19 wrap-around services and referrals for over 3,000 Bergen County residents, and providing thousands of New Jersey residents with connections to free COVID-19 testing and vaccinations. She is passionate about helping our community get the information needed to make informed health decisions, and is committed to improving health equity in Bergen County. So please know, as tonight's presentation is going to be recorded, so once you may have heard me talk about it a little bit earlier, but once it's ready, we'll put it on our Village of Ridgewood Stigma-Free Facebook page, and we'll also put it on the Village of Ridgewood homepage. And of course, if you need help finding it, you could always reach out to us at the health department. We will have a Q&A session, I guess, towards the end. Norkelis, is that okay? Or do you want to?
Yes.
Okay, so save your questions if you can for the end, or you put them, of course, as they come by in your mind, put them in the maybe Q&A chat box that's at the bottom of your screen, perhaps, or even in the chat box, however, whatever's easier for you. If, a question comes up afterwards, you could always reach out to us at the health department, and we'll get your question to Norkelis. But I think with that all being said, I think I'm going to let Norkelis take it away.
Wonderful. Thank you very much for that introduction. So good evening, everybody. My name is Norkelis. I am the Health Equity Manager for Greater Bergen. And I'm really excited to talk to you all about this winter illness guide. So just generally to have an open dialogue about what's been going on recently, and just some tips on how to stay safe and healthy throughout the season and beyond. We're recording, right? It's all good. I can move forward. Wonderful. All right, so we're going to be talking about symptoms and testing, prevention strategies, vaccines, boosters, and treatments, some final safety tips at the end, some general resources, and then the Q&A session for anybody who has any questions. All right, so what do these illnesses have in common, right? We have COVID-19, monkeypox, flu, also known as, influenza, also known as flu, and then the respiratory syncytial virus, which is RSV. So just think to yourselves for a moment, what do these illnesses have in common? So what do they have in common is their symptoms. So if you look at the graph here, we see symptoms of monkeypox listed on the red side, RSV in green, symptoms of influenza in blue, and then symptoms of COVID-19 in orange. I'm not gonna go over every single symptom on the screen. I'd rather we actually focus our attention to the symptoms listed in the center of the diagram. So These symptoms are all common within monkeypox, COVID-19, flu, and RSV. So some examples include fever or chills, coughing, headache, fatigue or exhaustion, muscle or body aches, and then congestion or runny nose. So why is any of this important to you? It's because it's really important to monitor your own symptoms and seek testing or general medical attention when you're feeling sick. Since all of these symptoms are so common within each of the illnesses, you are never really sure of which one you might have. So that's why it's recommended to go get tested. And even if you choose to not get tested, it's just best to stay home if you're feeling any of these symptoms. That way you don't spread any of the illnesses or any of these illnesses to anyone else. In terms of testing, there are tests available for COVID-19, monkeypox, and flu. At-home COVID-19 tests are available for free again, and they can be ordered online from the covid.gov/tests. All you need is basic information: your name, address, phone number, and email is optional. Actually, at GBCA, we also have our own supply of testing kits. If you feel more comfortable coming to pick it up, we don't require any information to be given. You can just come in or give us a call and say, hey, I would like, the free COVID-19 testing kits, and we will make sure to get that ready for you. So in addition, most insurances will cover the fee for other types of testings, but you should always call your provider to be sure. If you'd like more information on where to obtain any sort of testing, you can contact myself or your local health department by phone or email, and definitely we will be better able to assist you. Alrighty, so moving forward, how can I protect myself from these illnesses throughout this winter season? So the first line of defense includes getting vaccinated when you're eligible and staying up to date with your immunizations. So what we know is that vaccines can help protect you from severe illness, hospitalization, and deaths. These vaccines are available, vaccines are available for COVID-19, monkeypox, and flu. The COVID-19 vaccine is free, but some other vaccines may be charged to you or your insurance. So as I said in the last slide, it's always best to just contact your provider, make sure that the vaccine is covered and of no charge to you. So moving forward, the next line of defense would be to get tested and prevent the spread to others. So it's recommended if you're feeling any symptoms to go and get testing if possible and staying home until you fully recovered. As mentioned, there are tests available for COVID-19, monkeypox, and flu. And some of these tests can actually be delivered to your home. So you don't even have to leave your home to obtain them. As I said, most insurances will cover, but it's always good to check with your provider to make sure that you are not being charged for any of these tests. Moving forward, there is the recommendation to follow what to do when you have been exposed to any of these illnesses. So each illness has a different guideline and recommendation. So it's just best to follow the recommendations provided by your CDC or NJDOH according to the diagnosed illness. It's as simple, to be honest, as a Google search, right? All you would have to do is open up your browser, type in the search bar, what to do if I have been exposed to blank, and several options should appear from there. The most important piece, though, to that is that you want to be sure to get your information from a credible website. So that includes CDC, DOH, your local health department's website, and just other credible sources, right? Next one is washing your hands. People forget that our hands are something we use so often. So hands carry a lot of germs that you can't see. Washing your hands is one of the best things you can do to protect yourself, your family, your friends, all from getting sick. And then lastly is improving ventilation, moving air in and out within the room, filtration, and just generally opening up the airspace in whether it's your home, your office, or just whatever space you're in. Simply opening the windows can help ventilate the air and remove the virus and lessen the virus particles in the air within your home, your office, etc. So, like I said, for the first line of defense in terms of how can I protect myself, that includes vaccines. So let's talk a little bit about the COVID-19 vaccines. There are 4 available in the US. The mRNA vaccines available are Pfizer and Moderna, and that's available to everyone 6 months and older. And then there's also the Johnson & Johnson's Janssen vaccine, which is a 1-dose series, or the Novavax vaccine. It is a 2-dose series, both available to everyone 18 years and older. You are considered fully vaccinated 2 weeks after your 2-dose series or after your 1-dose series of Johnson & Johnson. It's very important to note that Johnson & Johnson is no longer highly recommended in comparison to Pfizer or Moderna. CDC and DOH does prefer an mRNA vaccine over the Janssen vaccine. All right, so moving forward, what you need to know about the updated COVID-19 boosters. So first and foremost, what is a booster? Boosters restore your immune protection against any of the illness as your, I've lost my train of thought. I'm sorry. I don't know if you heard the distraction in the back. I'm so sorry about that. So taking a step back, boosters restore your immune protection that has decreased over time after your primary series. So let's take the flu shot, for example. We are recommended to receive our flu shot every year, the flu booster, but more often than not, it is not called a flu booster. It's just called your yearly flu shot. So the concept is fairly similar with the COVID-19 vaccines, except it's just a different terminology. So moving forward, people are best protected against severe illness when they stay up to date with their COVID-19 vaccines, which include getting your boosters. The updated COVID-19 vaccines are also called bivalent boosters because they protect against both the original virus that causes the COVID-19 illness and the Omicron variant, BA4 and BA5. Now, that is not to get confused. I have heard some people confuse COVID-19 and Omicron to be 2 different illnesses. They are not. It is all under the COVID-19 umbrella. They are just, Omicron, Delta, etc., are different variations or different variants, right, of the original COVID-19. And then lastly, what you need to know is who is eligible. Everyone 6 months and older is eligible for an updated booster dose. Next, we have COVID-19 treatments. So treatments are available to everyone 12 years and up. We didn't have that always, right? In 2020, when COVID-19 came out, there were no treatments. There was just go home, get rest, or if there was severe illness, you were sent to the hospital, unfortunately. But now we have treatments for everyone 12 years or older, for people who test positive and are more likely to get severely sick. There are 2 types of treatments available. Antiviral treatments, which target specific parts of the virus to stop it from multiplying in the body and helping prevent severe illness and death. And then the next one is the monoclonal antibodies, which help the immune system recognize and respond more effectively to the virus. Regardless of which treatment chosen, it must be prescribed by a healthcare provider. And treatments must be started within a few days for them to be effective. Treatments are available both orally or administered through IV. So next, here we have the monkeypox vaccines. There are 2 monkeypox vaccines available. There is the Jynneos, which is preferred to the ACAM 2000. So the Jynneos, what we know is that it's 2 doses. They are 4 weeks apart, and it's developed specifically to protect against both monkeypox and smallpox. People are considered fully vaccinated 2 weeks after they've received their 2nd dose of the Jynneos vaccine. And then in terms of the ACAM 2000, that is a single dose, and people are considered fully vaccinated after 4 weeks of administration. Lastly, what we know about the ACAM 2000 is that it does have the potential to cause more side effects and adverse events in comparison to the Jynneos vaccine. So the monkeypox vaccine eligibility. This is a very, I don't want to call it complicated slide because it's not the right word to use, but it is complex. So I will try to sum it up as best as possible. So for eligibility for the monkeypox vaccine, one must be 18 years or older and have had known exposure to someone who tested positive to the orthopox virus or monkeypox virus in the last 2 weeks. So that's the main criteria. Moving after that, we also have men who have sex with men, transgender or non-binary individuals who in the past 6 months have had a new diagnosis to one or more STI or sexually transmitted infections. For example, HIV, chlamydia, gonorrhea, etc. Or another subcategory would include people who have had sex at commercial sex venues like a sex club or bathhouse, or have attended a sex event or venue or in an area generally where monkeypox has, the transmission has been highly occurring within the last 6 months. In addition, sexual partners with who have been involved with people who have experienced the above risks, individuals who anticipate experiencing the above risks, or people in certain occupational exposures. So those are medical professionals or people who deal or who work in, for example, halfway houses or just general areas where there is a high risk for interacting with these groups. So in sum, for monkeypox eligibility, one must be 18 years or older with known exposure to monkeypox in the last 2 weeks, or meet one of the subcategories of men who have sex with men, transgender or non-binary, who have been diagnosed with STIs, or have experience working in a commercial sex venue. Moving forward. So in terms of monkeypox treatment, unfortunately at this time, there is no specific treatment for monkeypox. There are antiviral medications being provided to protect against smallpox, and that could be used for the treatment of monkeypox. That would be the tecovirimat, also known as TPOXX. It is an FDA-approved treatment for smallpox. At this time, it's not FDA-approved for monkeypox, but it is undergoing investigations to determine whether it is safe for use in monkeypox. At this time, it has been used for treatment against monkeypox, and in order to obtain it, it has to be prescribed by a provider. So moving forward, we have the influenza or flu shots vaccines. So who's eligible for the flu shot? Everyone 6 months and older is eligible for a flu shot and are recommended to receive one every flu season. It is important to note that there are different recommendations based on age. So there is a vaccine for minors, children, and then also we have our vaccines for seniors. The vaccine can be provided in 3 different ways, 2 ways of which are by injection. One injection is made with inactivated influenza viruses, and then the other is without the activated influenza virus, right? So that's the 2 shot options. The next option is to receive a live attenuated influenza vaccine through nasal spray. So that's just a really complicated way of saying a vaccine through nasal spray, right? There's actually no shot being given. It's just this little bottle. Your doctor does it for you. They do on each side. They give you a little squirt. And like that, you are immunized, to the flu for that season. So for moving forward, we have influenza treatment. There is treatment available. It has to be provided by a healthcare provider. The different types of treatment include influenza antiviral drugs, and they can come in the form of pills, liquid, powder, or through IV injection. The treatment, like for the many other illnesses, should be started within 2 days from when you first develop the symptoms for them to be most effective. Waiting longer could prevent the medication from helping or from being as effective. as it would be. So we have our last virus here is RSV. So unfortunately, there is no specific treatment or vaccine available for RSV at this time. Most infections do go away on their own within 1 to 2 weeks. RSV is more common within children than it is within adults. And there are some steps you can take to help relieve your symptoms. So that includes managing your fever and pain with some over-the-counter medicines, fever reducers, pain relievers such as acetaminophen and ibuprofen. It is never recommended to give a child aspirin. I'd like to make that known. Moving forward, drinking enough fluids. So drinking water, Gatorade, things to keep your electrolytes up is very important to prevent dehydration. And then lastly, talking to your healthcare provider before giving a child non-prescription cold medicines. Some medicines or can contain ingredients that are not good for children. So it's just best to talk to your healthcare provider to ensure that you're giving them safe medication. So what to do if I get sick or you get sick? So of course, like we said in the beginning, it is best practice to stay home and get some rest, maintain your distance from others, wear a mask if you have to go out, wash your hands as often as possible. They truly do carry so many germs. And as long as we keep them clean as often as we can, it's really like washing away all of the germs, right? And then lastly, sanitizing highly touched surfaces. So like your desks, your cell phones, your mouse pad, even your keys is something that we can consider to clean on a regular basis because of how often you use them. So next thing to do is staying hydrated, drinking lots of water, tea, and any other beverages with electrolytes to keep you hydrated and to prevent dehydration. Moving forward, consider taking over-the-counter medicines that would provide some symptom relief. Medicine, it's really important to clarify that over-the-counter medicine is not a cure for any of the illnesses, but what it does do is relieve some of your symptoms. It will suppress some of those symptoms and will help you feel better throughout that time in which the illness is moving through your body. And then lastly, what to do, seek medical attention if your symptoms get worse, if you feel some new symptoms appear, and lastly, if fever is higher than 102 degrees for 24 hours. It's very important to go seek medical attention if you've experienced any of the following. So some final tips for how to stay healthy this winter. Staying up to date with all of your immunizations when you're eligible. That includes the COVID and flu boosters. Second includes staying hydrated. One of the best things you can do for your health is to drink optimal amounts of water every day. It plays a very large part in your health and immune system. Next is to eat for immunity. I know that sounds funny, but it's really important to eat healthy foods that support your immune system. So incorporating things like fruits, vegetables, foods high and rich in vitamin C into your daily meals. That'll really help keep your immune system healthy and strong. Next includes sleeping well. The average person needs 6 to 8 hours of sleep per night. So it's important to make sure you get enough sleep throughout the night. That way you can keep your immune system up and running as optimal as possible. Number 5 says to wash your hands regularly. I cannot stress this enough. Keep the bacteria, keep the viruses off of your hands, keep your hands clean, and don't forget to keep your hands out of your eyes, mouth, and ears to prevent any spread of illness. And then the last one is to keep moving and stay active. I know it's really hard to get exercise in the winter sometimes because of that cold weather, but even just simply 15 minutes a day moving around will really help keep your immune system active and your defenses up. So here I have just a list of some resources if anyone is interested. These are resources for COVID-19, the flu, and monkeypox. The first bulletin is for resources directly to CDC and NJDOH if you're interested in any information about COVID-19, flu, monkeypox, or any of the other common illnesses. The next bullet is for how and where to get vaccines. So if you'd like to schedule an appointment for the flu or COVID, you can visit vaccines.gov or call the number on the screen. Or you can simply just go into your Google site and try to search for your local pharmacy. Usually, more often than not, they will have that vaccine that you're looking for. If you're looking for information on monkeypox vaccines, they are a little bit more limited in the state of New Jersey, but we do have several sites available within most counties. So you can always visit nj.gov/health/monkeypox vaccines. Next bullet states that if you need transportation to your vaccine appointments, NJ Transit is participating in the NJ Vax Ride initiative. So you can request a free bus ride through NJ Transit on that link, njtransit.com/vaxride. The other form of transportation includes 211's partnership with United Way Worldwide and Lyft. You dial 211, you tell them exactly what it is you're looking for, that you would like a lift to your appointment, and they should be able to schedule that for you. This next slide just talks about some general resources if you're ever in need. You can visit for mental health resources, you can visit nj.gov/health/assets. All of these links can be provided to you all. The next one is for meal assistance. There's the program called NJ Helps. They do have certain criteria for assistance, but again, you can visit the website and see if you qualify for any of the benefits available. NJ Family Care is low to no cost health insurance. And right now, I believe the registration is still open. So if yourself or your child still doesn't have health insurance, feel free to visit this website. They have many different options available for a very low or no cost at all. And then the last one is for rental, utility, or energy assistance. You can visit the NJDCA housing, and on there's also a nice list of benefits provided by NJ housing. Are there any questions at this time? I'm not sure if.
And if you have any questions, you could also use the raise your hand. I forgot to mention this earlier, raise your hand chat feature. And we could unmute you if you want to, ask your question aloud. I really loved your PowerPoint slides. I loved how colorful they were. Your the way you presented, it was so organized, and the quick how to I guess prevent getting sick with those little quick facts, and especially reminding about how the over-the-counter medication treats symptoms, but it doesn't cure you.
Yeah, that seems to be a very large misconception. People will just take some Tylenol and go on their way. But at the end of the day, it doesn't, it just helps you feel a little bit better in the moment. We need to remember it is not a cure, it is not a treatment.
Yeah, you're still contagious.
Yes, that's the most important piece. Yes, you're still contagious until you are symptom-free.
Yeah. But I loved it. I think, that was really awesome. And, the way, I guess, I don't know if it's an infographic, how you explain the different, vaccinations. Really great.
Thank you.
I agree. I want to say, I think you did, you presented the information very clearly. So thank you for that.
Wonderful. That's always the goal. I hope, we were able to help and clarify some of the misinformation that's out there.
And I put the NJ Family Care link in the chat because that stood out to me because of how the new information about children under 19 may now apply to NJ Family Care regardless of their immigration status. I think that's a big thing.
If you'd like, I'm not sure if I should go back now and try to share some of those links, or if you want to, I can send them to you on a separate email. And that way we can share it with everyone.
Yeah, that works. It doesn't look like, I'm checking, doesn't look like anyone's raising their hand. And there's no Q&A. But for those that are still on, if you do have something comes up, you could always reach out to us at the health department, and we could reach out to you and share with Norcalese. We'll get the question answered somehow, some way.
Yes. So if there are no questions, I can move to the next slide that has my contact information. I know some people are more comfortable reaching out one-on-one. So as Danielle said, you can either call the health department or give us a call at GBCA, and we can definitely answer any questions you might have. Thank you, everybody, for taking the time for listening. And Danielle, I'll let you take it away.
So should we give it another minute or, oh, I see, thank you, can you?
So I'm just reaching out to the one person that said,
Yep.
to my email. So I'm reaching out.
Okay. Should we give it a few minutes, or do you think we're
Probably fine.
ready to wrap up?
We could probably wrap up.
Okay, okay, great.
Sounds good.
So I just wanted to say thank you to everyone who attended tonight's presentation. And we'd also like to thank Norcalese and Greater Bergen Community Action for providing this presentation. The information you provided was very useful, and I have to say I learned several things myself, so thank you for that. As a reminder, this presentation was recorded and will be available for further viewing on our Facebook page and the Village of Ridgewood's website. If you have any questions, please contact us for more information. And I'm just about to share my screen for a moment because we too would like to provide our contact information for anyone who would like to reach out to us. Give me a moment here to share. There we go. Sorry about that. Thank you for bearing with me there. So I want to, place our contact information there. You can see both my contact information and Danielle's contact information is on the bottom right there. And then I want to ask you all to please note that if you or someone you know is in need of assistance, whether it be for communicable disease information, resource related to social supports, or information on transportation, or whatever the case may be, please feel free to reach out to us. And our phone numbers are listed there. So thank you all again tonight for being present here with us. Have a great evening.
Bye, everyone.
Thank you again,
Bye,
Norcalese.
everyone. Thank you so much.
Thank you, Norcalese. Have a great night.
Same to you all.
Okay, so we can shut down the recording. I'm gonna just stop it there. And then I'm just gonna say yes.